So I'll be spending 10 or 15 minutes explaining that to them near the end of my first visit. And I work with my staff to make sure that they understand how to help support this person during this. Now, I have some other slides that I'm going to go through quickly so that I can get to the final case study. We see that, I mentioned this before, but the most common allergic reactions, this is IgE, allergic reactions, are to milk, eggs, peanuts, wheat, soy, fish, shellfish, also tree nuts. But people will have reactions not only to those things, but they may have it to other kinds of compounds that are present. They may have it to things such as chemicals like insecticides that I talked about earlier, or they may have problems where they have a reaction to histamine, a histaminic reaction to monosodium glutamate. So there are different kinds of food reactivities that can go on, particularly in relationship to processed foods. We see more and more and more processed foods being used here, as we've seen in the United States over the last 30 years. Moving away from foods as they come from the ground and having processed foods that have preservatives, mean they may have sulfates to preserve, or they may have sweeteners or dyes or colors or other preservatives. These can all cause various skin-related and allergic-related histamine release problems. I've also noted that when we talk about eliminating wheat and dairy from the diet and eggs, we have to be careful with the fact that, for instance, things like soy sauce have wheat in them. Pizza has eggs in it. Peanut butter has soy in it. Imitation butter flavor uses milk proteins. So even though it's not butter, it's got milk proteins that are present in it. Many people don't know that sorbet has eggs in it. So there's many different hidden forms of allergens. And another form of hidden allergen, it's not so much hidden, it's that many times people will have a reactivity to a food because they have a reactivity to another food or to various kinds of pollens that are present. So for instance, when we look at this, people who have allergies to pollens, 50% of them will have some reactivity to various fruits and vegetables. And many food reactions are just a cross-reactivity to some inhaled allergen. So for instance, we see that people who have a inhaled reaction to mugwort may actually be allergic to carrots and celery and certain spices. There are various grasses. People who are allergic to grasses may respond with an allergic reaction to potatoes and tomatoes. So there's a relationship between these two. Now, if you have an allergic reaction, you can desensitize with allergy shots, but you can also desensitize by helping support nutrition. Vitamin D, zinc, essential fatty acids, probiotics, these are the things that are most helpful. So again, I say you remove a food from a person and you help to support them to bring the system back into balance. Bring their gut into balance, bring their nutrition back into balance. It's what I talked about yesterday. Remove, replace, repopulate, repair, rebalance. Because when we heal the gut, we actually have the ability to be able to relate to these foods, to digest and absorb these foods and use them more appropriately. And we heal the gut, as I talked about yesterday, we're going to want to make sure that they have glutamine, fats, magnesium, zinc, and probiotics. For those of you who are looking for protocols on healing the gut, these are simple measures to be able to use to help that person. And finally, I'm going to talk about timing. And that is, if I've got someone who has an IgE, allergic reaction, I'm not going to reintroduce that food to them unless I've done a lot to help bring their immune system back into balance. If I have a food sensitivity, an IgG food sensitivity, I'm going to wait to reintroduce that food between 6 weeks and 6 months. I am going to reintroduce it because I don't want to take it away from them forever because of a concern that that can actually cause some undernutrition. So IgG sensitivity, 6 weeks to 6 months. I'm going to reintroduce the food and see how they feel. IgE allergy, I'm going to wait quite a while before and make sure they're in balance. Now, this is a recent study that says if I have an IgE food allergy, I'm going to, for eggs, milk, wheat, and soybeans, I'm going to stop that for 12 to 18 months. And after that time, I'm going to give a food challenge. If their IgE levels have been down, I'm going to give them a food challenge. If their IgE levels are still high, I'm not going to give them a challenge because I'm going to cause a problem. Now, with other agents like peanuts, fish, and nuts, I'm actually going to wait a longer period of time. I'm going to wait 3 years before I even do a food challenge. This is if they're IgE, immediate hypersensitivity, allergy. Right? Now, if they have IgG, if they're very, very, very reactive, I'm going to wait 4 to 6 months before I challenge them again. If they're only mild to moderately reactive, I'm going to wait about 3 months, 2 to 3 months for that to happen. Okay, this says 2 weeks up to 4 to 6 months. Generally, I'm saying about 3 months period of time. Mild to moderate, 3 months. Severe, 6 months. I'm going to wait that long before I reintroduce the foods. So in the time we have left, let's go over one more case. So this is another little boy, 3.5 years old, and has had atopic dermatitis from head to toe with itching, scratching that causes bleeding to occur. He's scratched so much that his fingernails have lifted up off of their bed. The mother is very, very concerned. The child has had this literally since the time he was born. And when the mom comes in, she just wants to decrease the rash. Here we see an example of the rash behind the neck. You can see it's pretty prominent. You can actually see where he's been scratching and it's bloody. He's not gaining weight. Nutritionally, he's depleted. She just wants him to be able to begin to feel better so he can go to school. And she's concerned about the medicines causing long-term problems for him. So when we look at our timeline, we start the timeline right here. We say, okay, he's 3.5 years old. He's got atopic illnesses, eczema, that's present. Doesn't yet have asthma, but certainly is a concern with atopic illnesses. He's got poor weight gain and he's malnourished. So let's look at the history. So as I said, atopic eczema from head to toe. He was only 6 weeks old when this first started to happen. So when you see that, you should consider what was happening with his birth and with his exposure to normal gut flora. You may say, well, what was the family history? And then you look down and you see that the mom has a history of allergy to foods and a lot of rashes, and the father has a history of atopic dermatitis. Fits into that category again that I spoke of earlier, the family history of atopic illness. The child is going to have some alterations in their gut flora from the time that they're born. Now, this child has had many different kinds of treatments. Most treatments, like prednisone and hydrocortisone cream, are just going to work to drive the skin manifestation back into the body. They're not going to help with the root cause. So we see with things like steroids, whether they're given orally or whether they're given topically in this kind of situation, is they do not get to the root cause. They force the symptom to go away for a short period of time, but as soon as we stop them, the symptom comes back. Or sometimes, if the symptoms are so strong, they'll break through. And many doctors will say, I just need to use a stronger steroid or more oral steroids, which have other consequences in the body, in the adrenal glands and the sensitivity to infection. So interestingly, we see that mom also had a lot of allergies during her pregnancy with the child, and she had reflux, and she was given proton pump inhibitors. So we actually know that the mother's gut flora and total body flora was altered while the baby was in utero. So he began to develop symptoms at 6 weeks of age, and by 3 months had eczema on his cheeks and on his trunk. By 8 months, not only was there chronic eczema around the entire body, but there was also diarrhea that was going on. Now, this child was breastfed, not bottle-fed, which is to his advantage, but he had poor weight gain. Because he was having not only the scratching with the eczema that was present on his body, he developed skin infections, impetigo, a cutaneous infection on top of the eczema from where he was scratching. And so he's put on Augmentin. Augmentin, which is a amoxicillin and clavulanic acid, which is good for skin infections, helped the infection part to go away, but we now see his rash getting worse. And we see his diarrhea getting worse as he's a year of age. So there's a topical antibiotic called Bactaban, which was used. And he was given cultured goat milk to try to help with his gut problems that were going on. We see that he's not eating well. They're trying to use limited foods in order to take care of what was underneath. And a stool test was done, and that stool test showed, recall yesterday, when I look at a stool test, I'm looking at the gut flora, I'm looking at two things. I'm saying, is there diversity? That is, does it have a proper array of the different kinds of bacteria that are there? And does it have function? We didn't look at function here, we just looked at diversity. And in the diversity we see that this child has very little of the bifidobacter that is most prevalent during the childhood period. Very, very low. And we see this Enterobacter cloacae, an opportunistic bacteria that's present. So we see that his gut is altered. When we look at IgE testing, acute immediate hypersensitivity response, we see that there is some small reaction to egg whites, but not a lot. So we don't see acute allergies, but we see alterations of the gut flora that are going on. So when we go from looking at IgE, the immediate hypersensitivity response, to IgG, the delayed hypersensitivity response, a comprehensive IgG panel, we see that there were many things. We can go through oats, peas, safflower, sunflower, many different things that the child was having a reaction to. When someone has a lot of IgG reactivity, it's telling you that they also have intestinal permeability that's going on. So we need to help. There's a repair issue that needs to happen there. In addition, with this child, we looked at him nutritionally, and we saw that he had low levels of zinc and potassium and selenium, low levels of zinc in his serum, low levels of zinc in his red blood cells. So we gave him various things. This is actually a previous physician. Vegetables, probiotics, pancreatic enzymes, glutamine, N-acetylcysteine. each of these things to be able to help. And he did okay until he was about 2.5 years old, where there was an aggravation that went on. And we saw was that there was a skin infection, and so he got put on antibiotics and topical steroids and antifungals to deal with the skin infection from the aggravation. So when we look at the timeline, we see that mother was pregnant. She had lots of allergies. Father had a history of atopic dermatitis. He was born, and we see that right away, while he was breastfeeding, he started having colic and a rash that occurred very, very early on. Began to develop diarrhea, had lots of antibiotics from infections both in the skin and the ear that occurred. So he went on this very severe diet, and he's undernourished. He's not getting the foods that he needs. We saw that the nutritional testing showed that he was very depleted in zinc at a very young age. So he's not getting the nutrition that he needs. Again, this is a risk if you have someone who is just doing an elimination diet and eliminating all kinds of foods. You need to be able to support the child nutritionally as well. So he's got poor weight gain. He was treated with Augmentin, where we said there's a worsening of the rash. Again, we see that he's on very, very few foods, and now we see that he is not doing well developmentally. He's not growing well, and his speech isn't doing well at this point in time. So when we look at him now at 3.5 years old, we see that his vitamin D levels are down. His IgE, acute allergic sensitivity, is raised, not only to various kinds of inhalant allergens, grasses and dust and cat hair, but also a strong reaction to various foods, an IgE-mediated hypersensitivity response, histamine-mediated, to all kinds of nuts, almonds, peanuts, walnuts, kiwis, rice, chickpea, navy beans. He was on a very restrictive diet, and these were the foods he was eating, and he's reacting to them. So they over-restricted his diet, and he's continued to have an IgE response to what's going on. Now, he did not have celiac disease, and we looked overall at what's called his omega-3 index, EPA plus DHA, it was low. And we look at a ratio of the omega-6 pro-inflammatory eicosanoids to omega-3, the anti-inflammatory eicosanoids. We saw that ratio is high. So he doesn't have enough of the beneficial omega-3 fats, and he's got an excess of the pro-inflammatory omega-6 fats. Now, this is a case study of a pretty sick child coming in. So remember, the first case study was very simple. Acute allergic response. Second case study, the 52-year-old man who had some joint pain, we were able to dial that in pretty simply. Third case of a child with asthma who was pretty sick, but we were able to use some pretty simple and straightforward kinds of therapeutics using probiotics, a multivitamin, and omega-3 oils to be able to bring that child back into balance. This case is obviously a lot more complex than that because things have been tried already with him. So when we look at the matrix model, we see that these antecedents of a family history, of recurrent antibiotic uses that are triggering agents. We see that he's undernourished and he's had alterations in his gut flora. We see that there have been both IgG and IgE reactivity that's occurred. We find that he's had lots of antibiotics, that there are issues with intestinal permeability that go on. And we see that he's undernourished in zinc. So there's a lot of different components. So I ask that you do what I talked about yesterday. What is it that we have excess of that we need to remove? And what is it that we have a deficiency of that we need to add back? And then looking at the overall nutritional status. Dr. Hughes will be talking about that after our break in just a few moments. So what's deficient and excess? Deficient is if he's deficient in the normal bacteria, we're going to add back lactobacillus and bifidobacter. If he's deficient in nutrients like zinc, we're going to add them back. If he's got these IgE-mediated responses to almond and peanuts and lentils and rice and kiwi, we're going to remove those and remove any foods that are associated with that. And we're going to look at overall, what does he need nutritionally? So we did that. We removed those foods. We gave him the support. We see a little bit of improvement going on in his gut, but we still see pretty severe with impetigo on the left cheek, right there. And we see as he's treated over time, now we see, we see the eczema changes here at the antecubital fossa, the antecubital fold, beginning to improve. We see overall diminution or decrease, significant decrease in the amount of inflammatory reactivity that's happening. Here we see now at 4 months period of time where the rashes on his stomach are completely gone. Difficult to see, here we go. Difficult to see here, but the impetigo is gone. The changes of the eczema on the face are gone. So what do we do? Well, we followed the remove, replace, repopulate, repair, rebalance. We gave him zinc and probiotics and a multivitamin based upon the testing that we had. So we see that when we heal the gut and bring it back into balance, when we work to remove the foods that are causing a problem, and when we give the nutrients that are needed, vitamin A, vitamin D, omega-3 fats, zinc, the child does better. So recall, as I said yesterday, remove, first piece. It's going to be a food elimination diet. It can be based upon eliminating foods and adding them back, or it can be based upon an IgG food testing, which is done. As we'll learn from Dr. Hyman, when you add back a food, you need to add back a single food to see how the person responds to that. You can't add back multiple foods at one time, or you won't know which one caused the problem. We want to remove any infections that's there. That wasn't the case in this last child. We have in your toolkit a tool to use for how to be able to apply the elimination diet, how to work with it. We want to replace. In the second case, we used betaine hydrochloric acid as a replacement because it was necessary. If you evaluate the stool, you find that there's a pancreatic enzyme insufficiency, you add that back. Repopulate. These are going to be the probiotics that I talked about yesterday. Generally, we're using somewhere between 25 and 200 billion colony-forming units in order to do that. Ultimately, using foods to bring balance to the system are what's going to be the best thing, but in the short term, for therapy, using probiotics, which are going to be mixed human strains of bifidobacter and lactobacillus and strep thermophilus, the things that constitute probiotics, in doses that range from 25 to 200 billion colony-forming units. For repair, we often use a rice-based formula, a medical food, to help when we're removing some of the foods from the diet in an elimination diet. Some people won't know what to eat. They won't get enough calories, and so we use a medical food, an anti-inflammatory medical food, one that has some amounts of anti-inflammatory herbs in it, as well as multivitamins. We use L-glutamine. L-glutamine is the fuel source that helps to repair the small intestinal lining. Zinc is a great tool for helping to repair. Zinc carnosine is the best formulation for being able to help repair the lining of the gut. And of course, the omega-3 fats in doses that range from 1 to 3 grams per day. If you have an acute inflammatory illness, inflammatory bowel disease, or an autoimmune disease that's inflammatory with elevations in hs-CRP, you may use higher doses. I generally go up to 6 grams, although as I said yesterday, you can go up to 20 grams of omega-3 fats. And then rebalance. Again, tomorrow afternoon I'll tell you more about heart rate variability biofeedback as a tool for helping to balance sympathetic and parasympathetic drive. At the bottom of the matrix we talk about sleep, exercise, nutrition, and stress, as well as family connections that go on, that help us to balance our lives. So as I wrap up, there are 3 things that I want you to do next week when you see a patient. So if you have someone who comes in with a gut issue, or an autoimmune issue, or a skin issue, or migraine headaches, or ask a question that they're concerned about their food, they say, I don't know if I'm eating the right things. First, ask the question, do you think there's something in your diet that might be causing a problem? I'll say that again. Do you think there's something in your diet that might be causing a problem? That's the first thing that you have to do. If they have a concern about that, you can help coach them in an elimination diet, in a modified elimination diet, to remove that from their diet, but remove it completely from their diet for a 2 to 3 week period of time, and then have them add it back. When you're looking at that picture, if they're able to do that or if they're not able to do that, you can say, and is there some further testing that I should do? Should I look for IgG allergies? Should I look for IgG sensitivities? Should I look at what's going on nutritionally with this person? So in the 7-step plan, the first thing is ask the question, then look for clues. Decide on testing. If they're having symptoms, use the agents that I talked about to bring them into balance, and then use the modified elimination diet. Overall, you're working to heal the gut, as I talked about yesterday, which will help to bring the food sensitivity and food allergy back into balance. And then when the time is right, depending upon what their symptom severity is and whether they had IgG or IgE problems, you're going to reintroduce those foods. So I've worked to try to show you how to work with the immune system. You're going to be learning more this morning about the nutritional aspects from Dr. Hughes, and then early this afternoon from Dr. Hyman about how to do and how to work with the elimination diet. And Dr. Ho later this afternoon will talk more about testing. So I hope this information has been helpful to you, and I look forward to continuing to work with you. Thank you.